Good afternoon, and thank you for joining us today. My name is John Bilstein. I'm the Chief Executive Officer of Comprehensive Cancer Centers. Today you'll be hearing from Vegas Golden Knights star defenseman Shea Theodore, Dr. Rupesh Parikh, Practice President of Comprehensive Cancer Centers, and Sherry Alexis, Development Manager at Susan G Komen Nevada. We're here today because we're pleased to announce a partnership with Shea Theodore, Comprehensive, and Susan G Komen Nevada. The initiative is called Kay's Power Play. The reason and its name are near and dear to Shea's heart. With that being said, we'd like to invite Shea Theodore to come up and say a few words. Ladies and gentlemen, Shea Theodore.
How's it going, guys? I'm not much of a public speaker, but I'm gonna try my best here. I'd like to thank everyone here today for their support, especially John Bilstein and Dr. Parikh from Comprehensive Cancer, and Sherry Alexis from Susan G Komen. Most people have heard my story and the importance of early detection behind it. I went to the World Championships last summer and found out I had cancer. So it's not only important for men to get tested and find out early, but and just really helping my grandmother with Comprehensive. They did an amazing job with her, and I'm very fortunate for this partnership. Today I'm here to bring awareness and early detection to the cause. I'm excited to launch the Kay's Power Play Foundation in regards to my grandmother. And I would like to thank everyone at Comprehensive Cancer, especially Dr. Parikh, who helped treat my grandmother. And he will now explain the importance of mammograms and early detection for the cause. Thank you very much.
Hi, good afternoon, everyone. I'd like to provide a couple of statistics to magnify the importance of how important breast cancer screening is, as well as programs like Kay's Power Play that's going to help us get some of these things done. In Nevada, there's about 2,300 new cases of breast cancer every year. And even with that, we still rank nationally below the national average in terms of screening. It's important to get screened. And in our practice, we're seeing more younger women, less than 40 years of age, with breast cancer. And especially this year, we're seeing cases that are diagnosed later because people have missed their screenings because of the COVID virus. So it's so important that prevention is the key message here. And Kay's Power Play is going to help us and be a vital resource with funds that are vitally needed to get these mammograms and screening exams done. A vital component of what we do at Comprehensive is to help prevent cancer, not only through efforts like this, but also in terms of prevention, genetic counseling, other services that we provide. I'd like to turn the microphone over now to Sherry Alexis, who's going to explain how this will work a little bit and how it'll support getting better screening done in the state of Nevada. Thank you.
Thank you, Dr. Parikh. I'm Sherry Alexis with Susan G Komen of Nevada. We represent all of Nevada, the whole entire state of Nevada. And let me first say that we are honored to partner with Kay's Power Play Foundation and grateful to Shea Theodore and Comprehensive Cancer Centers for seeing the need and creating this fund to focus on critical needs of people in Nevada who would not have access to these life-saving resources through their insurance. Mammograms save lives. Early detection does more than help reduce the mortality rate to 1%. It can reduce long, painful treatment periods and time away from family, friends, and loved ones. Insurance does cover mammograms, but you may have limited access if you are under 40. Kay's Power Play has created a way to reduce the barriers to early detection. If you are uninsured, underinsured, meaning your insurance will not cover a mammogram at the time, and are at risk of breast cancer through various factors, including family history or a change in your normal breast health, you are a candidate for Kay's Power Play Fund. You can access this information for the fund through KomenNevada.org's local resource page, or you can call us at our office, 702-822-2324, and we will be able to help you connect to the Kay's Power Play Fund. We will continue to work with our partners to provide these services to the Kay Power Play recipients. Again, Komen Nevada is pleased to participating with Shea Theodore and Comprehensive Cancer Centers in taking care of at-risk family, friends, and neighbors in Nevada. Please reach out to our office if you have any more need for any more information. Thank you.
Thank you to Shea Theodore, Dr. Parikh, and Sherry with Susan G Komen. We're thrilled to announce that the contribution by Shea Theodore and the donation by Comprehensive Cancer Centers today, that we will be providing a check here with Lisa Santwer's assistance to Susan G Komen Nevada in the amount of $50,000. This donation with Kay's Power Play is in the memory of Shea Theodore's grandmother. So again, thank you to everybody today. We are beyond thrilled to have a partnership with Shea and with Susan G Komen. And again, all this money stays local in the state of Nevada. Thank you again for coming out today. Dr. Parikh. Shea.
Yeah, keep your masks on, please. And then just space out just a little bit. Sherry, yes, space out just a little bit from Dr. Parikh, please. Thank you. Okay, let's straight answer here, please. I will check.
Photoshopping the pounds off, right? I heard that in the waiver.
All right, is everyone good with photos? Now let's move to questions. So if they, let's start with Shea, maybe, and then people can ask questions.
questions we already know the answers to, but if you could, just tell us what your motivation is for doing this.
I think just really trying to help anybody and everybody that I can. It's a great partnership with Comprehensive Cancer and the Susan G Komen Foundation, and I think this is going to help a lot of people.
I'm curious, I thought initially this would be for maybe men and testicular cancer, but you chose breast cancer because of your grandmother. Why did you choose to go that route as opposed to something you dealt with personally?
I think originally, I wanted to work with men and testicular cancer, but with the recent passing of my grandmother, I thought this took much greater importance, and it's an honor for them to help me out with Cave Power Play and really to help women all over Nevada.
Did you actually bring your grandma here to have treatment?
Yes, I did. Yes.
When did that happen?
That was last year. Dr. Parikh, he was amazing. From everything that he did, and it made sense, for this partnership and to start Cave Power Play.
What do you think she'd be thinking?
I know she'd be proud. I sent my parents kind of the lowdown on what we were doing, and my dad was very proud, and said she'd be tickled pink, he called it. So it would be an honor. So.
I guess one more question. What made her treatment here so special? What stuck out about it?
I just think the care right when she got here, the scans that she was able to get, and the treatment plan that they put together was the best that there was, and it's just an honor to be partnered with them. Thank you.
Does anyone have questions about breast cancer in general at all for Dr. Parikh? I know a big thing is October is a huge focus for Breast Cancer Awareness Month, but it really extends throughout the entire year. Mammograms are important every month, not just October. So, any questions for the doctor?
I think if people watch, they might be wondering how. Can you repeat the information about how people get in touch?
Oh, in touch?
Yeah.
Okay. Oh, time out. I will tell you, I do appreciate the focus on all of our health. So, we're obviously in the middle of a pandemic, so the timing may be shift ever so slightly. But, our mantra has been from the start that cancer doesn't stop, and neither do we. So we're working with our partners that do screening mammograms to get up to speed as quickly as possible. But we will have the information, how to access the fund, which is not a lot of paperwork. You don't have to turn in your tax return. It's not like filing for a loan. It's literally connecting to us through the office, answering a short series of questions, and then finding out where you are. Because we have access to screening mammograms all over the state. So you don't have to travel. And then all we're gonna do is pay the tab. That's what this will have. Because insurance does cover screening mammograms for people that are over a certain age. Even if you have insurance and you're under a certain age, sometimes it is not covered. But that's where the underinsured comes in. As I have always told people, I've always had insurance, but I can't always get what the medical requires because I can't afford to cover the copay or the payment for it. So that's what this fund will do. We'll help people that are at risk, come from a family where multiple members of the family have had breast cancer, they're younger than the screening age, and they're concerned. We don't want that to be a barrier, so that's why we're doing this. Yes, sir?
$50,000 is a lot of money. Can you give us an idea of how many screenings this can go towards?
Yes, so it's so funny you should ask that question because I had to do a really quick study on that and found that just the raw price, right? Not the insurance price, not what the insurance will cover, but typically just the raw price of a mammogram is between $300 and $375. So somebody do that math for me. And again, our goal is, obviously we're heavily populated down here in Southern Nevada. So certainly a large portion of that money will probably end up down here just because of the population, but we do not want to limit people based on where they're living if they live in Nevada. So, and that's why I like we have a couple of partners that have traveling mammogram vehicles. And it's, there's the Mammovan, but there's also several other partners that have vehicles. So we will be utilizing those as well. Oh, one more time, KomenNevada.org. And then under that, there's a local resources page, or you can call the office, which is 702-822-2324. And you will get Dawn.
Thank you.
Any other questions for any of our speakers today?
For the doctor. Your main message here is it early detection. That's what you're trying to drive home.
Yeah, so I think the main message is early detection is for sure. And especially during this time. I mean, we have seen cancer screening rates drop by about 40% across the network, across the country because of this virus. We want to start telling those patients, don't delay your screens anymore. We're open. The radiology centers are open to get these screenings done. And the longer you wait, the longer that cancer sits inside you and has a chance to spread. And we don't want that. We never want to treat cancer. If we can prevent it, we can catch it at an early stage, stage 0, stage 1. You don't need to see us all the time. But that's what this message is about. It's about prevention. It's about getting that message across, saying that, you know, if you feel a lump, go to guard. COVID's not going away, unfortunately, but neither is cancer. Cancer doesn't sleep. That's what I tell everyone, and I think that message needs to be resonated and delivered to the population.
Anyone else? Any other questions? All right.
Thank you all. We appreciate you guys all coming.
Thanks, everyone.